AD here. Welcome back to my channel. Just on my lunch break, a 12-hour shift. You've thought of joining the healthcare team here as a nurse, any category of nurse at all, either staff nurse, a midwife, and you're thinking about how to go about the NMBI registration quickly. So the video is about just avoiding any delay in your process. All right, let's just get in and have a look.
Now, before you start the process, get things organized. Do a little bit of checks and put every requirement down before you go on to the online process. So the first check, assess yourself. If you've been absent from practice for 5 years or more, you have to go for a program called Return to Nursing Practice. This program will assist you to build your professional skills, competencies relevant for patient care planning, and then also to provide nursing care as a member of a multidisciplinary team in any healthcare setting. Because nursing has become a very long way and it's a bit complex now. You are responsible for your actions and inactions. So that's why competency is key. Apart from that, if you're active in the service, are you affiliated with a professional body, with your professional body? Any authentic nurse is affiliated with a professional authority like the NMC, the INC, or the NMBI as we are here. English proficiency. English is the basic language we use to provide care, to communicate here. So you need to get your English proficiency results, a current one. And the required English test that they want is the IELTS, that's the International English Language Test System, the academic type. A score of 7 in 3 of the categories and 6.5 in one of the categories in just a single setting. So reading, writing, speaking, and listening. 6.5, and then the rest 7. That's the minimum one. Or the occupational English test requirements, result of B in 3 of the categories and then C plus in 1 of the category. That is taken on a computer, in a room, like in a center. You don't want the online one. So the NMBI will use your candidate number to assess the authenticity of the results that you provide. Now, your documents. Get all your documents ready. So proof of ID, your valid passport. If you don't have a valid passport, you can have a copy of your national ID card, birth certificate, your school certificate, your nursing school certificate. All these documents bearing the same name and your date of birth. It should be a colored photocopy. Or if you have changed names, you give evidence of change of name from probably your birth cert or your marriage certificate, saying that that's where the change of name comes from. All these must be colored, duly signed by a commissioner of oath, a solicitor, a lawyer, or any of those people bearing their signature, their stamp, sealed, and then date and name and contact, and then their specific profession on that. So all these must be. If you fail to provide it, that will delay the process, and this is what we want to prevent. Okay. Now, qualification document or qualification certificate is also one thing you need to get. So the transcripts from your colleges, university that you went, those transcripts should be a yearly broken down of the clinical and theoretical hours for each of the subjects you did, precise credit hours. Each page should also be endorsed or certified by a person who is actually responsible for certifications, such as the principal or the dean of your school or any officer from the academic office. It depends on where you're coming from, principal or any of those have to also certify or endorse those documents. So a specialized education assessor from the NMBI will scrutinize the clinical hours and the theoretical content of your qualification that you bring, and then see to it that it meets the NMBI requirements. So they combine all these hours, and then as per your transcript, and then you can see you have successfully completed a compensation measure. Okay, moving on to your certificate of current professional status. That is why I said previously that you need to be affiliated with a professional body, because the professional body will provide a certificate of your current professional status. Are you in active practice? They will give feedback to NMBI. So request that certificate from your council, your authority, and then give the NMBI their email address, and they will send it straight to them. Request a hard copy of that certificate, because sometimes if it doesn't reach NMBI, it will delay the process. So that if they tell you we've not received it, you just send it via Quora, and then you get to them and hasten the process. Okay. Histories. What are your histories? Your educational history. Things to remember from that side. So educational, all the dates that you went to school, right from your diploma to your degree, your master's, or whatever. Remember all the dates, and that's what you're going to provide your transcript for. So these dates on your transcript should correspond to that of your CCPS, and then your employment history as well. Also remember all the years you've worked, the day you started working, where you moved on to another department, or you moved to years that you moved to another hospital or another facility. All those should also be in mind. All right. If there's any gap with your employment, put it in writing. Give explanation of all those before we upload it. And that ends with our checks.